Good morning, everybody, and welcome to another Insight AppSab webinar or seminar. To start with, I'd like to pay our respects and acknowledge the traditional owners and custodians of the land on which we're meeting today, and I'd like to extend that welcome and respect to any Aboriginal or Torres Strait Islanders that are joining us. So welcome both online and in the room. Today it gives me great pleasure to introduce Heidi Sturk. Now, I saw Heidi present for another conference that we did last year, and with the way the world is changing and everybody relying on our mobile phones and electronic resources for help, I thought it may be something that some of the clinicians out there would find useful. So please give a warm welcome to Heidi Sturk, and she will explain further. Thank you.
Thank you, Jim. Thank you and welcome. Welcome to everyone in the room and welcome to those online as well. So yes, I'm going to do a presentation about all things digital. It's a fairly practical session, so I'll be going through some resources and giving you some ideas. I will try not to talk too quickly. Sometimes I talk very fast because I know the area. Just wave at me for those in the room, if I look like I'm talking too quickly. First of all, I would also like to acknowledge the traditional owners of this country and show my respect for their traditions and customs and knowledge. So just a little bit of an outline of what I'm going to talk about. So a little bit about digital mental health and how it's developed in Australia. I'll talk about the Digital Mental Health Gateway, launched by the government in October 2017, Head to Health. I'll give some examples of resources. I'll also give some examples of Aboriginal and Torres Strait Islander resources, and talk about what you need to think about when you're recommending them. So when I'm talking about digital health, I mean, sometimes it's termed e-mental health as well, but lately over the last few years, the term is more digital mental health, but it's the one and the same thing. And so we're talking about services, programs or apps that are delivered via online, mobile or phone-based platforms. And we're talking about all of these types of resources. So the phone crisis lines get included, your online chats, information sites, your forums that are moderated, and you've got programs that are self-guided and also have therapist support built into them, and apps. And I'll be giving examples of all of these during the talk. So what is eMHPrac, or e-mental health in practice? So we were funded by the Commonwealth Department of Health in 2013, so we've been running for a while. And our goal is to raise awareness of digital mental health for health practitioners to use with their clients. And we provide free training to the health practitioners as well. And we also advise the government on policy in digital mental health. We do a lot of travel around Australia. We go to lots of conferences, do presentations like this, do trade exhibits, and we do a lot of awareness sessions with small organisations, such as this one today. We work with GPs and we work with allied health and also with service providers working in Indigenous communities. We're partnered with Black Dog Institute, who do a lot of the GP training. We also partner with Menzies School of Health Research in Darwin and the University Centre for Rural Health, which is part of University of Sydney, and they're based in Lismore in New South Wales. And when I say psychologists, allied health, we've actually branched out over the last couple of years. We're now working with school guidance counsellors as well, school nurses, podiatrists, pharmacists, lots of other groups and professions are interested in these resources, and they can be very useful for a wide range of people. So this is just a little bit about what we do. We do a lot of the promotion and education, as I said there. We've got some materials that I'll talk about too, and we've also got an online a website with online modules, webinars and podcasts. So as you know, we are very digitally connected nowadays, and you can see there that the majority of us access the internet quite a few times a day. It says there 74% 3 or more times a day, and I would imagine for some people it'd be much more than that, especially with our phones in our hands. So I won't go into details with this. It's just to give you a little bit of information about our usage and how many people actually have a smartphone and are using it. I actually have a good friend a few years ago said, she had a little Nokia and she goes, I'm never getting one of those smartphones. I don't need that. This is fine. She's got a smartphone now. So yes, it's very rare. There are still some people that have the little Nokias, but a lot of us have the smartphones. So why digital mental health? Why has it arisen? Apart from just having access to technology, what about mental health? As you know, there is low access to services in Australia, and this is for a number of reasons. So obviously the services aren't there in a lot of the rural and remote areas. If they are there, they might know them, so they're not going to want to go and see somebody. There's the stigma of that. There's the cost as well, and there's also waiting lists. Even if there is help, if you're in a city, sometimes there's 6 months waiting lists. There's also just prior experience. If you've had a bad experience seeing someone, you might not want to go and get help. And we also know that men and young people are more reluctant to seek face-to-face help as well. And so the beauty of the digital mental health resources is that they can give an increased treatment access. There's growing demand for these. And Australia was actually a pioneer in the development of the internet treatment programs. ANU did the first one, called Mood Gym, in 2001. And it's still around. It's been revised. And we just like to stress that it's an additional tool. We're not saying people need to use digital mental health or have to, but for many people who don't have access to face-to-face support, this might be the only way that they might get help. The step care model is often talked about, and some of you might have seen this as well. So this is where we're talking about matching the intensity of treatment to the intensity of the condition. So for some people who are at risk and have early symptoms, previous illness, some self-help resources and low-intensity interventions like digital mental health can be particularly helpful. And you can see as you move up from mild to moderate to severe, a lot more care is needed, which is common sense. But it's just looking at where digital mental health can fit in. So digital mental health can be used for mild to moderate, but other support is needed at the same time. And so the benefits, we can access at any time and any place if you've got internet connection, and many of us have. I'm not saying it's always brilliant, like even in North Brisbane, I know we only just got the NBN a few weeks ago. So to my 15-year-old son, who's thrilled to have it, but he says it's not actually that much quicker. We have it. The other really good thing is it can be anonymous. No one needs to know you're getting help, which is a really big plus. It addresses those issues of stigma. Many of the ones I'm talking about today, 98%, are free because they've been government funded. So there's no cost to the consumer, which is really a really big draw card. And research has actually shown that online programs can be as effective as face-to-face treatment for mild to moderate conditions, particularly if there's additional practitioner support. And there's a lot of some really good research. And anyone who wants to get access to that can contact me and we can put you on to that. But you do have to consider a few things. Obviously, download cost, particularly in rural and remote areas. Young people have prepaid plans, so they're not going to be wanting to download things and materials. A lot of the developers of programs and apps are aware of this now and trying to make it so that there's not lots of download. There is still varied access to internet. People will still have a preference for face-to-face therapy, and that's fine. Some people might not want to use these. That's okay. Variable digital literacy, as we know. Unfortunately, there's not a lot of programs that are in other languages at the moment, and hopefully that'll change over time. We all know about technical problems and just becoming familiar with the resource as a health practitioner before you recommend it to a client. And as I said before, didn't realise I had this slide twice, so there's a lot of research out there, so I can pass that on to people. So how do you go about finding evidence-based online resources or digital mental health resources? There's a couple of ways we recommend. Obviously, there's us. We've been funded to train health practitioners. We have a useful resource guide that lists all of the evidence-based programs in Australia. It's updated every few months. It's also available as a PDF on our website as well. Head to Health, the Digital Mental Health Gateway, which I'll go through some features of that. And we advise that you go through research institutions or government agencies or bodies that are basing their programs on research, so you know that it's reliable, because there's a lot of organisations or companies or people out there trying to develop programs or apps and saying, oh, these will be great, these will fix what you've got, and there's no evidence whatsoever behind them. And people don't know that. Like, people just Google and take what they see on Google and think, oh, that must be right. So this is what our resource guide looks like. People can search in a number of ways: by diagnosis, by target group, or by delivery mode. And I've got some here for the people who are in the room. You're welcome to take an information pack, and we're happy to post them out to people as well. We've got an order form on our website for free, so we post that out for free. So that's our website there, eMHPrac.org.au. We've got resource guide there, and you've got the order form as well. So Head to Health. Who here has heard of Head to Health in the room? A few of you have. So yes, it was launched October 2017, nearly 380 resources on there, majority are free, and they did do an extensive consultation process, so with people with lived experience, health professionals, mental health service providers. That's what it looks like there. There is a button up the top there for people who are needing urgent help to take them through to the 000 or to Lifeline if they need to. There's a little video there. It's designed for the phone as well. Works very well on the phone. And so I'll just go through a couple of features. They have a little chat, Sam the Chatbot. So Sam is found under menu on the mobile device. And the reason that Sam is quite good is Sam will actually give you a few suggestions. So sometimes you might just type in a search term like anxiety and you just get anything to do with anxiety, but there might be other issues going on as well. So I'll give you an example. So tell me your situation. I've typed in my son is drinking too much alcohol. Sam comes up with a number of suggestions and I can look at them and think, oh, actually, yes, maybe I should look at the parenting, raising children aspect as well as the drinking too much and addiction. So, and you can go back and choose different ones if you want as well. And then Sam comes up with these suggestions and you can click on which suggestion you want to look at first. You can actually choose a filter if you want to. So format refers to whether it's an app or a program or just information. Age group, young people, adults, older people. And population group is Aboriginal and Torres Strait Islander, LGBTIQ. So there's a few different options there. So they come up with a little, well, that's just an example of the format there. And then they come up with a number of websites. So you can see there it's got 9 websites. You can click on the purple button there and just find out a little bit more about it. You can actually go show more and it takes you to the other websites there. And if you want, you can then go through and link to that website. So that's just a couple of websites. If you just keep scrolling down, it shows you those. And then this is if I've clicked on a purple one. So, and this is what it tells me, a little bit more information about Hello Sunday Morning, which you all would have heard about. And then you can open the link in a new tab if you want. You can share it or save it. So you can email it to yourself or to a client if you're sitting there with them. As you keep scrolling down, you get the apps and programs. We actually suggested that they put them separately, but because people sometimes get a bit confused, but they decided they still wanted to put them together. And we just say to people, if it's an app, it says app in the title, so Daybreak app. Again, phone, chat and email comes down with that. You keep scrolling down for that. And then if you just want to do a general search, that's fine. If you don't want to do Sam the Chatbot, you can just type in alcohol and drugs. You might want to do a filter and you can just search for that. You can email or print the resources on this way as well if you're just doing a general search. Down the bottom you can see that you can email down there, or you can also print resources as well. And you can save the resources. Those little stars in the right-hand corner, the one that's filled in, you've clicked on that and saved it. And you can see up on the top right there, I've got 2 saved resources, so I must have something else. Oh yeah, down the bottom right, I've saved that as well. And if you actually go out of this browser, it'll actually delete it for safety and privacy reasons. So if you don't want someone to see what you're looking at, you can click save this link for next time. And you can share the saved resources as well. Now, when you email them to yourself or someone else, it doesn't come in the little coloured boxes. It just comes as a list. It's nice and easy and clear to follow, but it's more text-based, but it's very easy to follow. And if you actually want to look at who the service providers are on Head to Health, you can click on the right-hand side where it's got service providers, and they list them. At this stage, there's 30 different service providers that provide a number of different resources. And you can see, for example, Black Dog Institute have got 7 websites built within their main website that focus on certain areas. And they've got 2 apps and programs. So that's quite useful for people to look through. And they've got some topic headings at the top too that you can look at and find a bit more information about, say, if you're supporting children or young adults or parents. They've done promotion. They've done a letter to all GPs in Australia. They've got business cards and postcards, which we can send out as well. They've done some little animated videos about Head to Health and how they use it. That's been distributed to a number of different places that you can see there. They do social media posts, especially around like particular days like Christmas, Valentine's Day, days where people can often have a lot of conflicting feelings. They have newsletter articles, and obviously eMHPrac does a lot of the promotion as well. And we have, in those folders, we've got some examples of them as well. With the health professionals that we've trained, a lot of them do find it very useful. It's a really good one-stop shop where people can just go, links them to all the well-known Australian resources. It is user-friendly, it's easy to navigate. People do like the chatbot. It gives you good suggestions that you might not have thought about. And people like it because they can go to somewhere that's trusted. They know they're actually getting safe information. And the save an email features weren't there originally, and that's something that they added in based on our feedback, so that's been really useful. And they've won a couple of awards about the website as well. So now onto the really useful part, some examples of digital mental health resources on Head to Health. I'll also talk about some that aren't yet on there at the moment, because at the moment it's only federal government funded resources that are on there. So anything that's been state funded or from another organisation, they're not on there. But they're going through an accreditation process to add stuff on, and I'll talk about that. So if we're looking at information sites, I'll just give you some examples of some little highlights about some of these. Obviously Beyond Blue is very well known, but one of the reasons I like to mention this one is it's got some great multicultural resources. So if you actually just type in multicultural in their search function, they actually have a lot of fact sheets about mental health in a number of different languages, like up to about 25, 30 different languages. And they've also got some assessment tools as well in different languages. So that's particularly useful, and people don't always realise that. Blue Knot Foundation, this is a website which is for young people who've suffered trauma. It provides support to them as adults, and also for people who are supporting them. There's actually information for health practitioners, and we've actually had a lot of health professionals say that this is a really useful website. It was the first in the world to provide evidence-based trauma guidelines, and there's a lot of really useful resources. Not everybody knows about it. It's getting more known about over time, but highly recommended. Forums. We'd just like to remind people that it's really important that young people or any age are using forums that have moderators, because there's a lot of forums out there where people can just write anything. It's important to have moderators who can filter out abusive or unsafe language. So yeah, that's something we really want to let people know about. ReachOut is one that's very well known for young people, but it's also really useful for parents. There's parent forums, and they can talk about issues that they're worried about or concerned about. They have practical tips, there's fact sheets as well. And Beyond Blue has forums as well. Sane is another one. This is for carers and people with lived experience, and they have a lot of peer-to-peer support. So that's another quite well-known one, but we just like to remind you. Now, self-guided programs. I mentioned before Mood Gym, so yeah, that came out in 2001. It's been revamped and updated over time. Now, the thing with self-guided programs is you do have to have a login, so because you're going through some modules, but you don't have to use your own email. You can actually just set up an anonymous Gmail email or any other email and go on there. So people like that for reasons of being anonymous. And we also like to recommend this to health professionals to use these resources for themselves too, because we get burnt out and we need support, and often health professionals don't know who to turn to or who to get help from, especially if you're in a regional rural area or even in a city area. And a lot of medical staff and psychologists don't want to go and get help themselves because then they're concerned they'll get reported. And so some of these resources are good for them to do themselves. So as you can see there, Mood Gym is very well known. It's been used internationally a lot as well. They have a lot of good information about what happens with their data, and so you want to know that when you're looking at a site if they have that information up front. Because so Mood Gym is particularly based on CBT to help prevent and manage symptoms of depression, and they also touch anxiety as well. There's 5 modules that people have to work through, and they're 20 to 40 minutes long, and there's a free clinician manual and an interactive workbook as well. So the beauty of some of these programs is someone can go online and do them themselves, but also someone can actually go online and do them with a health practitioner supporting them and chatting to them about how they're going, and each session, talk about some of the things that they're going through and what might be helping them. ANU have also done another one called eCouch, and that also is a self-help interactive program. So they focus on a few other areas like anxiety as well, but they also do relationship breakdown and loss and grief, and there's not a lot out there in these areas. And you can see it draws on a few different areas such as CBT, but it also has some interpersonal therapies like relaxation and physical activity as well. And all of these ones I'm talking about today have all got evidence and research behind them. We're actually putting a section on our website with all the evidence from all the different programs so that people will be able to go online and just look at that. My Compass is from Black Dog Institute, and My Compass, this one is designed for either the web or either for phones as well, works really well on them, or apps, and it teaches resilience and wellbeing for people who've got stress, anxiety or depression. And it has real-time monitoring of your symptoms, you can do that on your phone, and it has interactive skill building modules. So you actually go on here, talks a bit about the treatment, you learn new ways to deal with thoughts, feelings and behaviours. They do recommend 7 weeks is really good because people get the best results with that. They've got 14 different activities that they can do. You don't have to do them in order, and they include things like there's managing worry, there's problem solving, there's particularly one on men's health. So there's a number of different ones that you can focus, and you can go back and redo them if you want to as well. And you can see there they've actually got sections for young adults, seniors, and also for healthcare professionals as well. You can choose your activities, and you get a dashboard and it tracks your results as you're going along as well, so people really like that. It's nice and user-friendly. Another one that Black Dog Institute has is one for young people called Bite Back, and this has a number of different activities aimed. They're using positive psychology and they're aiming at improving overall wellbeing and resilience as well. And it's particularly aimed at young people aged 12 to 18. It has interactive quizzes. It's got some activities, stories and videos about things that have worked for other people. And interestingly, the Central and Eastern Sydney PHN got all their staff to do Bite Back, even though they're all adults, just to know about it, to recommend to their service providers and to clients. And they found it actually a really good team building experience as well, going through something like this. And another thing we found is some of the workshops that we run, health professionals were saying to us, oh, young people don't always want to try things. They say, oh, yes, I'll try it, but they never get around to looking at it because there's so much stuff that we get told to look at nowadays. And one lady said that she asks them, would you look at this and recommend it to me and tell me whether it's worthwhile for me to use with others? And she said people actually that works quite well, and they actually go, oh yes, that's good, and then they start doing it. And so she's a little bit clever and does it like that, which is very interesting. MumSpace is a suite of programs, particularly aimed at parents, not just mums, even though it's called MumSpace. There's a couple of programs within that. So there's one called What Were We Thinking for new parents, and they might identify with that when it's 1 a.m. in the morning and their child is not sleeping. And so yeah, there's strategies and little videos, and there's an app that goes with it as well. And so there's got some practical skills for settling babies. Would have been good when I had my first child 20 years ago, but these things didn't exist then. Didn't even have Facebook to announce the birth on then either. There's also Baby Steps, which is a free online program, and it's for mums and dads. And there's a few more resources, particularly aimed at dads in that one, which is good because they often get left out. There's also some online programs. These are free online treatments, and they have one for antenatal depression and one for postnatal depression. Again, and so they can work through these. They're particular modules, they're interactive, they have some tailored feedback built in, there's parent and health videos as well, and they have low-intensity SMS messages built in to provide regular contact and advice and encouragement to remain motivated and to finish them. Because that's the problem with some of the self-guided ones. People might start doing 1 or 2 things and then life gets in the way and they don't finish the remaining sessions, whereas if they're getting a bit more advice and encouragement on the way, they're much more likely to, and they really get the benefits if they complete them. All the research of the programs shows that. Guided by a therapist coach. Who's heard of MindSpot in this room? Okay, not many of you. MindSpot is a fantastic resource. Now, MindSpot is the Australian government's free clinic and provides free therapist support to any Australians over the age of 18. So it actually has assessment on there, it gives feedback and referral, and then you can work through an 8-week course that has 5 lessons during that time. And it's run out of Macquarie University in Sydney, and you actually get support from qualified psychologists. So they've got about 30 to 40 psychologists working with them and social workers. So you can actually self-refer, just go online and look and do an assessment, and then one of their team will contact you in a day or so and talk about your results and what might be helpful, if one of the courses might be helpful or any other resources. You can work through the courses on your own, or you can choose to have therapist support, and you can choose for them to ring you once a week and they can talk to you for like quarter of an hour, half an hour, or you can choose for email contact, and that could be weekly or just when you need it. So there's quite a few options in there. These are the courses that they have. They've got wellbeing course, which is aimed for adults to help adults learn to manage their stress and anxiety and depression. They've got a wellbeing plus course for people aged 60 plus. Indigenous wellbeing course that was developed by Aboriginal people. A mood mechanic for young people aged 18 to 25. OCD, a PTSD, and a pain course. And a lot of pain clinics now, quite a few GPs will now recommend this one as well. All of their treatment courses have been based on lots of trials and research with their eCentre clinic. They've actually found, I think they've got some, they gave me some slides very kindly. They've actually found that people choose MindSpot for the reasons that privacy, stigma or face-to-face treatment's too confronting, 40%. Difficult accessing traditional services, 35%. And interestingly, that when they first set up, they thought that everybody would be wanting treatment, but they actually found that a lot of people just want to go online, do an assessment and learn about their symptoms and what's happening to them and learn about some of the services. And 25% go on and actually do the treatment. So they were interested to find that. And 70% complete the treatment. They actually get an average of 50% reduction in their symptoms of the anxiety and depression, which is sustained 3 months later. And these results are actually really good, considering that a lot of the people that come to them have come to them at the last resort. They've actually had years of symptoms, years of maybe not getting much help or not wanting to seek help, and they have very good effect sizes. They have 95% of their participants would recommend treatment and that it was worth doing the course. They've actually had, I don't know if it says on the next slide yet, I'll see. Oh, they don't have it on that next slide. They've had 100,000 people go through their courses since it started in 2013. They will actually mail out workbooks to people too, so if people are actually don't have good access to internet and they want something like that, they can get that as well. So it's really worthwhile knowing, and I've gone to a lot of places that are rural and go, oh, we wish we knew about this. They do social media as well and get the word out there, but the more people know about it, it's such a lovely resource to have. And this is just an example of some of the research behind their wellbeing course, just to show all the work that they've done for this. Another online therapist-supported program is called Mental Health Online, which is run by Swinburne University. And this is actually one that's aimed at anybody experiencing mental health difficulties. And I mean, a lot of these we say that they're for people with mild to moderate symptoms before they get too bad. But as MindSpot's found, people will often go to them even if they've got more severe help and severe symptoms, and often they can still find some help and support. And some of the research has shown that sometimes people who will go to these sites will then go and seek help because they've actually learnt about what might be able to help them. So Mental Health Online also has an online assessment called ePass. They've got a 12-week program, and again, you can just do it on your own or you can get therapist support. This one also has video or instant messaging involved as well. And these are their courses. And people often say, well, which would I choose? Would I choose MindSpot? Would I choose this one? And we say it's personal preference. So often as a health practitioner, you might look at one and think that's actually going to be more suitable for my clients. They do have health practitioner sections that you can look at and find more detail, and we're more than happy to provide more information. And so are the services themselves. And people might do one at MindSpot and then maybe a year later do another one, think this would be good, and you might get something slightly different out of a different one. The third therapist-supported program that I'll talk about is This Way Up, and this is run out of University of New South Wales and St Vincent's Hospital. This is a slightly different one. They have a number of courses, and this is where your own clinician will actually support you through it. So you can actually do quite a few of their courses self-guided, but they have somewhere that your doctor or a psychologist actually logs on, and they will be sent your results and have information about how you're going, and they can check in with you. And quite a few doctors, especially in New South Wales, are very familiar with this and use this one. This is the courses that they have there. You can see they've got a variety of different ones: a panic course, social phobia, a health anxiety. They've also got a pain course as well, a teen strong and a mum momentum one. The main thing with this is it does cost. It is a $60 cost per course. You could have 3 months to do the course, but they can extend it for up to a year if you don't complete it in that time. And they do find that because people pay, they often have more buy-in to it and they're more likely to complete it. And they often market it as it's the price of a coffee a week. And so, sometimes that paying for it, you're more likely to complete it and finish it. And you can see there's information for clinicians, and they will provide a bit more information and training if you want to do this. It's available on phone as well for people. So this is just a bit of information you can click on. They have a lot of comic book based stories where you can follow the journey of a character as they learn practical skills. You can download summaries and activities to reinforce what you've learnt. You can read real life stories about how others have overcome their depression, and you can schedule your next lesson so that you actually have reminders. And so a lot of people like to use it on the app because it's there, so you can be going through that anytime you wish. Again, you just need to have an email. They've got a lot of research behind theirs, and also I was down in Hobart recently for the Rural Health Conference, and we actually found there was the chief medical officer for the Antarctic division. He spoke that they use This Way Up for all their clinicians down in Antarctica, because down there they have to be there for 9 months of the year where they cannot get out. So your mental health is really important down there. So that was interesting. And I told This Way Up that, and they said, oh, that was good to hear that was being talked about. We actually get data from the key government programs. These include things like Mood Gym and MindSpot, about how many people are contacting them each year and whether they're referred by a health professional. So you can see over the last 5 years that the number of contacts to the web program, so this includes self-guided and therapist supported. We can break that down if we need to. You can see it's risen by 53% over the last 5 years, so there is an increase in people contacting these resources. We also do that for online chat. That's increased by 43%, from 71,000 people to 102,000 people. And we also still get the phone line data. And you can see there that hasn't risen as much, but it's still being used. There's 1 million people that will use the phone line services like Lifeline and Kids Helpline and QLife. So in terms of Head to Health, they want to add more resources onto Head to Health. I've jumped ahead of myself. I've got to talk about apps a bit first, then I'll talk about their accreditation. So apps, we just want to let people know that so many apps out there and people are downloading them, but there's a lack of supporting evidence for them. People do want to use them though, but you just need to be aware of where it's come from and who's used it. So you do want to use ones that have come out of reputable organisations. QUT have actually developed what's called the MARS, Mobile App Rating Scale. There's a lot of information on this, but we can provide this to people who are interested. There's a scale and people can actually assess an app and look at it based on these particular classifications. And it's particularly important, like the focus, theoretical background, who's developed it, because there's a lot of stuff out there that's been developed just to try and make money and have things, trying to get added costs when you're using it. Certification framework, that's what I started talking about before. So there's actually an Australian Commission of Safety and Quality in Healthcare. They've got a digital mental health advisory group, and they're seeking to establish a certification framework and national standards for all these digital mental health services. And so it'll be government funded and other. And so then once they have that certification framework, they'll be able to put up other resources on Head to Health as well. There's a report going to the government by June this year. So with apps, there's a couple of good apps that I'll just highlight. There's ReachOut. I have a couple called Breathe and WorryTime. These are free. Breathe is really good for people having panic attacks and anxiety. It's only aimed for Apple users, but it just helps you manage your breathing and helps calm your physical symptoms down when you're having a panic attack. And it's really good because you've got your phone there, and if you're at a shops or somewhere where there's people, you can use it. WorryTime is where you put your worries aside for a particular time, and research has actually shown this is actually beneficial for people to do this, and it actually can help them manage their worries a little bit more. Beyond Blue have got a really good app called Beyond Our Suicide Safety Plan. Now this app, just make sure I don't miss out any of the notes. So users can create a safety plan that they can then refer to or have reminders when they are feeling a crisis or feeling suicidal, and who they contact, things that they have to live for. It's really good if they set this up with a support person or a family member. And last year I went to a presentation, they had 18,000 downloads and 11,000 safety plans have been completed. They have it on the website as well if someone wants to do it on a website rather than on their phone. Youthbeyondblue also have one called the Check-in, and it can be used by any age, not just young people. And it's got some really good ideas about how to check in with a friend if you're worried about, because I know a lot of young people go, I don't really know what to do or what to say, and people can actually use these as a guide. And Are You OK does a lot of good work like that as well, but this is there on your phone to help remind you. I talked about ReachOut forums before. I just want to let you know they have a section called Tools and Apps, and they have a lot of international ones there as well. So you can actually go on there and find quite a broad range of apps and tools as well that you can go on and have a look at. So just a couple of other resources before we finish up soon. So these aren't on Head to Health yet, but they're in our booklet and on our website. Brave program is a really good one that's come out of Griffith University and UQ, and it's for young people to manage anxiety. You can see there's actually a couple of different age group ones that they are aimed at, and they also have so you do need an account for that one as well. And they also have a parent program, so the parent can go and do the program alongside supporting their child as well. Again, this is a self-guided one, but health professionals could still work with a young person through it. A lot of schools and guidance counsellors in schools like this one, and using this one. And that's been around for about 12 years now as well. My Digital Health has come out of Federation University, which is based in Ballarat, and this one has a number of different courses. It's still under evaluation at the moment, so users will be asked to do evaluation when they use the courses, but they've got a nice range of courses. They're listed here. They actually have a couple that's I Consider Life is actually a suicide prevention course. Mind Time is mindfulness. Life Flex for PTSD. So you can go online and look at them a little bit more detail. I've got an example of the sleep one. There's a little bit of information there, so you can see it's a 6-module mobile or web-based program, self-monitoring of sleep, how to enhance thinking, and they can integrate a Fitbit wearable device as well if they want to as well. Some of you might have heard of this one already. This isn't a program as such, this is just Information Centre for Clinical Interventions in WA. They have some fantastic resources for clinicians. So you can have a look at information handouts, worksheets and workbooks. So there's a number of them, they're really good. A lot of people love downloading them and reading them and using them. The workbooks do cost $40, so you can buy them and they'll send them out to you. Raise Night Out is an app that QUT developed. This is for young people to learn about their drinking practices and to manage them. There's a little panda called Ray, and he does silly things. You can take him out, you can buy him, bring some food and make him dance and flirt and play bar trivia. And you have to try and take good care of him, not let him cross his stupid line. And so they can have fun while they're learning some things as well. So David Kavanagh was involved with that one. And these are free. Another couple, they'll talk about Prism App. This came out of Monash University. This is where you can actually learn about your mood. You keep a report of your mood and how you're going, and it gives you a summary. And the more you use it, the more it actually becomes, it's guided by what you say. It provides some health information based on your mood as well, and it links you to resources. Another one that's come out of Monash University as well, which I really like, is Mood Mission App. And this one is actually, you type in how you're feeling, and it comes up with 5 simple, effective, evidence-based missions to improve your mood. So you can choose one of them. All the missions are taken from scientific research. Completing missions earns you points, and it gives you helps to motivate you to have steps to become healthier. And it gets to know what you put in. So if you're liking exercise or outdoor things, it will suggest more things for that. If you like more reading or music, it gets to know things like that. So yeah, and they've got some papers out about this app. So that's a great one there. And I know a couple of psychologists said they find these ones really good for sessions, because then they can talk to them about what might have happened 2 weeks ago, and they can actually refer to them, oh yes, I was feeling that and it was because of this. And so it can be a really useful prompt sometimes in treatment sessions. My slides, I'm nearly finished. Okay, good. just some resources for Aboriginal and Torres Strait Islander people. So a guided by therapist and coach. Stay Strong is one that's been developed for iPads or tablets. It came out of Menzies in Northern Territory, and it's for use by a health practitioner. It's a goal-based, strength-based program. It's interactive and it's very visual and practitioner-led. And this is what is based on. So they talk about the people that keep them strong. So you could actually have the person entering this with you, or you could enter it for them, and you could sit side by side. You don't necessarily have to be front facing. You could sit under a tree and do this. They talk about the things that keep them strong, so they can click on these things. You can highlight them and type in a bit more detail once you've, it takes you through to another little box. They talk, and you can see the tree goes stronger the more the things they have. My worries, same sort of thing. And then they have goals and they have steps, and they break that down, and then they get a summary about their goals. You can screenshot these and send them, or you can actually print them out. The good thing about this is that once it's downloaded on iPad, you don't have to have internet connection. You can take it anywhere and use it, and then once you're back in internet connection, you could email it if you need to. And it's password protected, so you can have many practitioners using it. They've all got their own password, and they can have as many clients as they wish on there. I actually asked the developer how many clients could they have, and he said as many as they want. So that's interesting. So it does cost $13 to download it, but if you download it in an organisation, everybody who downloads it on that ID can use it again. So it's a really good resource, and they use it a lot in Northern Territory and South Australia. Headspace have got some really good fact sheets for Aboriginal and Torres Strait Islander people called Yarns Safe, and they did a campaign educating young people in Aboriginal and Torres Strait Islander communities about getting help, and they had a 32% increase in people seeking help after running this campaign. I really love this one. iTalk is a resource that's come out of Alice Springs. It's been around for a little while, and it's a website and app for iPads, and they have visual stories about a number of topics. So this one is called Worry Boss, and they're talking about how they manage that. So it's great. It's not too text heavy, and quite a few people in far north Queensland that I was training said this would be a lovely one for them just to get some conversations going. They're free. They do have a number of different stories. It's a bit hard to read them, but it's not just mental health, it's anything. They actually have managing the court system, managing finances, crocodile safety, all sorts of topics. You can actually get a video made with them as well. They do that, and they've actually got 16 different Aboriginal languages and 10 international languages. Proper Deadly, this is a number of podcasts and stories about Aboriginal and Torres Strait Islander people living with depression and anxiety and talking about their stories. So when you're recommending a resource, obviously it is important to become familiar with that yourself before recommending it to a client. And we often say even just start off with one or two. If you think there's a client that might benefit from one of these, just get to know that one quite well, so then it doesn't feel daunting, because it still can be a bit daunting. I think there's a lot out there. But yeah, just maybe choose a self-guided program that you might think, oh, a therapist to support one, get familiar with that. Obviously, it's good to make some specific recommendations. Maybe you should sit down and show them, go through it with them, help them register. That often is a really good thing to help people start, and follow up with them. And we just have a case study. It's just to give you an idea of some of the things that you need to consider. With Helen, you can see she's got 2 teenage children in her 40s. She's had depression before. She's been on antidepressants. Her partner's got diabetes and not complying. And she's had some recent recurrence of symptoms. So if you are using Helen and thinking what could be useful for her digital mental health, so her current concerns are depression and anxiety and wellbeing. She's adult female, she's a parent. Does she have good access to technology? She does. Good internet, she's got a computer, she's got a smartphone. Does she need human support to do any of the digital mental health? She's literate, she's motivated, and she's willing to do on her own. So then some of the things you might recommend to her is the Breathe app if she's feeling anxious or panicky when she's out and about or even at home. She might want to work through some of the My Compass modules and just get a bit more information about that. It's not too threatening, it's nice and easy, you can have on her phone. And she might want to work through a MindSpot course on her own. She might want to do an assessment, get someone to guide her, or she might want a therapist support. The other thing I didn't mention with MindSpot, if you've got a GP and you want the GP to have your resources from MindSpot, you can ask them to be sent to your GP, but that's your choice. You don't have to do that as well. So that's just our website, just to let people know that this is out there and that you can order the booklets. We have the order form there that you can, like we send out, say, 300 or 400 resources to schools or to PHNs or to GP practices, so we're more than happy to send out. Black Dog Institute have also done a number of webinars that are on our website as well. People can link to. We're actually updating our website at the moment, and we're going to have this as a button on the very front page. So there's some for psychologists, allied health, so just a bit more detail than what I've been able to do today. So if you just want to look at mobile apps, or you just want to look at practitioner perspectives, or just young people, you just need to have an email address to go on these. You just go on, put your email, and then they'll send you the link via email, and then you can look at it at any time. They're about an hour. They also have some GP webinars. Anybody can actually go on these. You don't have to be a GP. Again, you just have to have an email address. So I've gone on and had a look at quite a few of these. GPs can get accreditation points for them, doing them. And I had a look at the alcohol misuse and mental health one the other day. It was more about GPs identifying how to work with somebody who's got alcohol issues, and there was a couple of recommendations of some programs at the end as well. But there's 26 of them, so anybody's welcome to go on there and have a look at them. You can see there they've got management of pain, insomnia, effects of trauma. So just acknowledging David Kavanagh, who's the head of our project, and all our partners. And I'm more than happy to take questions, and thank you for listening.
Thank you very much. Thank you very much, Heidi, for opening our eyes to what's available on our mobile phones other than
Yes.
So thank you for that. Have we got any questions in the room? No.
I'll show you what's in the information pack if you like. So
Yeah, by all means. I have a few questions online.
Yeah.
By all means.
Oh, good. So this is the book there. You can all take one of these afterwards, or some spares. We have some little brochures. We have the there's a child and youth brochure, which is very popular. A little screen cleaner for your phones, and some pens. So yeah, just a few littles, and we can post any of this out.
Fabulous. I have a couple of questions from our viewers in webinar land. One of them is, you mentioned about having computer literacy, but somebody has asked if you're aware of any resources that are available for people with an intellectual or a cognitive.
No, I get asked that a little bit, and there's not a lot around, but Stay Strong, some people are looking at adapting that one because that isn't too text heavy and it's quite visual. It actually is being adapted for farmers actually as well, but at the moment there's not a lot. I can, MindSpot's fairly text heavy, unfortunately, and My Compass, a lot of people have to be fairly literate as well for that. If they want, they can email me and I can see if there's anything specific depending on the group, if they like. I'm more than happy to be contacted. I think, have I got my, my email details are on there, so I'm more than happy to be contacted about that.
Thank you for that, Heidi. When it comes to third-party developers of the apps or the websites, do you know who owns the data for those sites?
That's written into their contracts. So yeah, for example, like for Black Dog and MindSpot, and for MindSpot, it's MindSpot and Black Dog as well. Yeah.
And the final question I had is, which I think you've already answered, is what's the order form link for the hard copy of the resources? Which
Oh yes, if you go to the website, and it's just on the front page as well. Yeah.
Lovely. That's it. Just check before we go, any questions in the room? No, thank you. Now we all have an excuse to play on our mobile phones. So
well, that's true, yes. Yes.
If you would like to thank everyone for Heidi's presentation, thank you.
Thank you.